Hi, this is Danny Carroll, the state senator from the 2nd District of Kentucky.
Hello, this is Senator Mike Nemes from Bullitt County.
My name is Jennifer Washburn. I am from Marshall County, Kentucky. I am the executive director and owner of iKids Childhood Enrichment Center in Marshall County, and I've had my early childhood education center for 21 years.
I wanted to give you just a little background on a meeting that we had today in Program Review and Investigations. During that meeting, we were able to discuss child care in our state. And as you know, child care facilities will be opening up again on Monday, June the 15th. And some of the problems that we're having throughout the state is the centers are only able to open with a limited census. The classrooms are limited to 10 kids, and there are other parameters that have been put in. And there's a lot of concern in the state right now that many of our centers are not going to survive the events of the pandemic and the restrictions that have been put on the centers being closed for so long.
Today was an amazing opportunity to have our voice heard as child care providers here at the state level, to be able to share our struggles in being shut down so quickly, answering the call to join the team to prevent the spread of COVID. During that time, we operated as a limited duration child care center, providing care for the essential workers, healthcare providers in our community. During that time, we are proud to say that we have had 0 incidents of COVID in either our staff or our children. We've taken great measures to provide the health and safety of our children by providing increased sanitation, in wearing masks while we're with our children, making sure that we limit the visitors into our space, and providing, in addition to that, amazing care to meet the social and emotional needs of our children and our families. Proving that we've been able to do that, we hope and pray that the legislature as well as the governor's office is able to hear that we are confident in our abilities to do this going forward as child care centers under our original license. If you're not aware, under new regulations, child care centers have had to decrease capacity because of group size restrictions. That means in my center alone, we've lost 20 slots for children in our community. That's over 20% decrease in revenue, and we've had to increase our staffing by 20% in order to meet the additional regulations and requirements. That's very lopsided. As a business owner, it frightens me in our ability to be able to maintain this and to continue this long term. If we are no longer in operation, that's not just 20 slots that are lost in our community, that's 97 slots that are lost in our community for early childhood care and education. We know that the incidence of child abuse and neglect reporting has actually gone down in Kentucky during this time. That's not a good thing. It's simply because the children are not with us in safe environments where we can provide the care, the oversight, and education that they need to be safe. We ask deeply that the restrictions be reconsidered so that we can open at our normal performance, our normal capacity, and our normal ability to provide the care that we've done for in our space over 21 years. Again, we thank you for the opportunity to voice our concerns. We encourage everyone else to voice their concerns as well, not just providers, but it's time for families to reach out and tell what you need and how childcare, early childhood environments have helped you to be the strong families in our Commonwealth that we know that you are. Thank you.
About 52% of our population lives in a child care desert as it stands. The state simply cannot afford to lose more child care facilities. Our economy must have these places. Our kids need a safe, nurturing environment to be at, and our families need help. Our parents need to work, they need help with their kids.
The governor shut the child care industry down right away, and I think it's time to reopen it. The child care industry does a great job for us. There's 3 things that they really do for us. Is our workers need child care so they can go to work and produce. The children, they need the child care to understand what's going on and to learn and be productive citizens and workers in the future. And plus, these daycare centers or child care centers are businesses that employ people.
And so we met today and we discussed that. We brought in several child care providers, the Secretary of Cabinet for Health and Family Services. We had a very lengthy 2.5-hour discussion to try to bring these issues to the forefront, and hopes it will generate some conversation and perhaps get the attention of the governor to reassess where we are in child care. We need to make some changes. The crisis is going to get worse. There is no data that verifies, that even makes us suspect that it is more dangerous for the kids to be in childcare. We're not aware of any deaths in this entire country in the states that have stayed open as far as their childcare, and not one in our state related to that. So we're hoping that the governor, the cabinet, will quickly reassess data throughout the country, perhaps make some changes and allow our facilities to open up and increase their census so they can survive this pandemic. Their services are badly needed, and we must give them the assistance and allow them to survive into the future. Thank you, and I appreciate your attention this afternoon. And please take the time to voice your opinion through social media and through your representatives through the governor's office to share your opinion about this and where we can help these centers, help our families, and help our kids. Thank you very much.